Public health in Trinidad and Tobago is a catastrophe. It is a fiasco. It is the sixth and seventh circles of hell. Some people say public health in Trinidad is sickening. The Prime Minister agrees. Judging by his latest decision, 4.5 years later, as Prime Minister, the man who spent upwards of $25 billion on public health in this country has chosen once again to seek his own health care in other jurisdictions. Public health in Trinidad and Tobago has never worked to the benefit of the public under no government at no time. We, the people of Trinidad and Tobago, are spending money we do not have, building hospitals we do not need, in a public health system that does not work. The Progressive Empowerment Party suggests that in place of the fiasco that exists as our public health system, that we replace it all with 41 public health centers, one for each constituency, operated 24/7, managed by nurse practitioners with on-call doctors capable of treating dental, optical, and medical emergencies, to function as 41 emergency rooms in this country, equipped even for minor stabilization surgeries and with dedicated ambulance service. This would function far better than the chaos of the centralized public health system that does not work. How it should work, how it works in foreign jurisdictions. A call to a call center should be answered by a trained operator who knows how to ask proper questions so as to guide paramedics listening in on the line as to what your condition might be, so that they can prepare to treat with you when they arrive. The call to that call center that identifies your location plugs in GPS coordinates that guides the ambulance directly to you, so they don't have to call asking for further directions, looking for landmarks. A call to a call center that guides the ambulance to your house in under 10 minutes, the magic time that science suggests required to save patients in emergencies such as heart attack, stroke, and other massive failure. The paramedic operated ambulance is stocked and equipped with everything to treat with just about every emergency. But in specialized cases, there are special kits that they could add in quick time. And that is why the questions that a trained operator asking would advise them and guide them, so that when they come to you, your treatment begins during transportation. The paramedics then take full responsibility for you and initiate conversation with the closest emergency room where they're taking you. The doctor on call or the person in charge would then exchange information with the paramedics so as to further guide the treatment that is being done while you're being transported to the emergency room, and the emergency room would be preparing to receive you. Arriving at the hospital, the paramedics are greeted by the emergency room team, who takes full control of you, guides you into the treatment room, puts you onto a bed, releases the stretcher, and releases the paramedics and the ambulance. In a first world country, at that point, the emergency room staff are responsible for you, and they treat and discharge you, or they treat and admit you to hospital for further treatment. If at any point along the way the worst should occur and you expire, there are morbidity and mortality conferences that you can request beyond an autopsy if suspicion exists that someone along the way was remiss in their responsibility or negligent. And everyone in that chain, from the operator at the call center to the ambulance driver, the paramedic, the emergency room team, and any doctors and nurses treating with you after, are aware that there are serious consequences for malpractice, including charges of depraved indifference to human life. This is the level of public health we are entitled to in this country. We spend $5 billion a year for our public health and get this fiasco in exchange. Isn't it time we did better? The Progressive Empowerment Party says so, and says that there are people in the world that we could hire and empower and employ to provide proper, adequate, professional, first world public health in Trinidad and Tobago, as described before. We can have a better country. We can have proper health care. It's a matter of voting. It's a matter of choice. What we do next is important. I am Philip Edward Alexander, and this has been a little more than 3 minutes to a better Trinidad and Tobago.